a patient can relapse or die from something else first. These are competing risks. How do you compare treatments when both can happen? This is where Gray's test comes in. It compares cumulative incidence across groups, properly accounting for competing events. A cancer trial, drug group versus control. We want to know, does the drug reduce relapse? Now here's the problem with the log-rank test. This patient dies at month 8 from something unrelated, not a relapse. The log-rank test would treat this patient as censored, as if they could still relapse. But they can't. They're dead. Gray's test handles this correctly. It keeps the patient in the risk set, but knows they can't relapse anymore. Cumulative incidence functions. The control group's cumulative incidence of relapse climbs to 52% by 24 months. The drug group stays lower, only 35%. The drug seems to reduce relapse. A 17 percentage point gap at 24 months. But is it statistically significant? The test. Gray's test compares observed versus expected events at each time point, weighted by the cumulative incidence. It produces a chi-squared statistic. Chi-squared equals 4.82 with 1 degree of freedom. P equals 0.028. Significant. The drug genuinely reduces the cumulative incidence of relapse. Why not just use the log-rank test? The Kaplan-Meier approach overestimates the incidence. It pretends competing deaths never happened. Gray's test uses the cumulative incidence function. It gives the correct probability of relapse, accounting for deaths that happened along the way. When to use it? Use Gray's test when patients can experience competing events, like relapse versus death. For comparing groups, drug versus control, treatment A versus B, and as a first step before fitting a fine Gray regression model. If there are no competing risks, just use the log-rank test instead. Try it free at MetricGate.com.